Okay, now for the fun part, which is putting actual lens on our eye. So our first patient, I won't try to pronounce that.
We can call him Neil. He prefers it to Shaw as Neil.
So keratoconus diagnosed. He had grafts in both eyes, one in 2003, one in 2009. He's very successfully wearing a biophonic toric in his left eye. Monica tried a Rose K2 XL, which is dispensed here, but he's having some issues, 6 hours a day, but breaks only after 3 hours for 30 minutes. So we want to see if we can actually improve that fit. Right lens, after 3 hours of wear, staining was found. So this was his topographies, and very typical of a graft. There's no regular pattern. You can get all sorts of shapes on graft. But the big thing to notice is that the mean K is 7.71. So we have a graft. You're going to choose either one of those two designs, but Monica has tried this and he didn't tolerate it well. So we're going to go to the XL design, which is more easily tolerated. And you go to the Rose K2 fitting guide, which you can get from the distributor. Also, the choice of making that was he's comfortably wearing a soft lens in his left eye. You try to fit him with a corneal lens in his right eye, he will not love you very much at all. He'll probably be unsuccessful tolerating a corneal lens in his other eye because his left eye feels so good. So the keratoconus guide for XL, the mean K of 7.7 indicates your first trial lens at 7.6. So can we go ahead and put the 7.6
We've
lens?
already just now we've inserted that 7.6 with the fluorescein in the eye, and you can come in here.
So this lens is the indicated lens is 7.6. So the first thing, if we can go live now with the slit lamp, please.
Standard. This is standard edge, no?
So all the trial sets, unless you specifically want them, are standard edge lift.
Okay. मीनाक्षी नहीं तो आप अपना ले लो. The lens set which you have given is the standard edge, no? Yes. Yes. Okay. Fine. We just wanted to be sure.
Let's come from your.
No.
So hopefully we can bring up that live image and show you what's happening.
Who just got it? Yeah, standard lens. Okay, we'll have the lights switched off, please. Lights switched off. Yeah.
We haven't managed to bring it up yet.
Yeah. Yeah, you can bring it up there.
So while they're trying that, any questions at all about what I've presented today? Any burning questions? Do many of you fit Rose K lenses at all? Not some, not too many. If you don't fit irregular corneas, it's not that difficult once you've done a few. There is a learning curve, but it is very rewarding. Your patients will love you forever if you get them right. I'm sorry about this hitch. Technology, huh?
We did check this out before, and it was working.
So, as it has been said, when we put the trial lens on the eye, we have put fluorescein already when we inserted the lens in it. So it has to be pre-inserted, and that's the base curve which has been the first empirical calculation which has been put on the eye. And now we're going to observe. And as Dr. Paul had said, we look at the highest point as the center.
One thing about insertion for those that fit scleral lenses It's very easy to get bubbles when you insert it. The way you avoid that is you fill the lens with non-preserved saline, you put a drop of fluorescein in it, you have the patient, I always have the patient stand and lean over, and then you insert it, ask the patient to get involved. I always have the patient hold their top lid or their bottom lid, and you only have to manage one. The patient, hold your bottom lid down, I only need to hold the top lid up. Are we there?
Almost there. Almost there.
Thank
Can
you.
we just take the luminosity down a bit, Jody?
Yeah.
It's a bit too bright.
Yeah.
Take it down a bit.
Yeah. Okay.
That's very poor quality. Very hard to tell at all what's happening here. I'll tell you what, why don't, Monica, we go and use the screen here,
Yeah. Yeah.
rather than use the projector, which
yeah,
looks like
yeah.
it's going to cause us problems. Why don't we just connect to the screen? It's going to be
Yeah,
small, but I think
yeah.
we'll at least be able to see something on the screen. So we just use the screen that came up quite well before. Yeah. This is not going to give us anything we can see at all. Oh, you could do that?
Huh.
We'll see how we go on this.
ठीक है, ठीक है. Thank you. Yeah, yeah.
So the first lens we tried was 7.6, but it was definitely flat. So we're going to go on Monica's decision 0.4 steeper, and we're going to try a 7.2. Because what we were seeing is we were seeing touch here, and we were seeing touch here. And that will cause us problems.
आराम से. We can do it. Give fluorescein ready. Yeah. Meenakshi, fill the fluorescein. Yeah. Keep the fluorescein ready. So if we can all see Meenakshi's hand, Pooja, who's in front?
When you're inserting the lens,
Herself,
I
right.
prefer a large plunger, and I cut the
We
bottom
can't
off.
see
so
you.
it
Meenakshi,
can't-
your
it
image is
can't
actually
stick.
coming in.
I prefer a larger, wider plunger. All you do is moisten the top of it and place your lens on it. I cut it off so you actually has no force. It just sits there. And that's
भैया
very
पेशेंट की
successful.
आंख की तरफ कर दो. हाँ, हाँ. Yeah. So the head has to be exactly parallel to the floor, and that is very important if you don't want the bubbles inside. That's the only technique in sclerals which is important. It hasn't to be at any angle. It has to be straight parallel to the floor. So it just caps over the eye very easily.
So we just go turn the lights off again if we can.
I think we can try without lights because it takes a lot of system setup if we have to switch on off. Okay. So I think this projection is, Jyoti, just move the slit the other side. Yeah. I think we can do better to see it like this. Yeah, or still more angled, a little more angled. Yeah, I think we can see better with this projector.
I think that's not going to work. Let's just forget it. Huh?
Yeah.
Let's just use the screen here. Jolie, just turn the light up a bit more, thanks.
Yeah.
For me. Just the illumination a bit higher, Jody. Illumination a bit higher on your slit lamp. Yeah.
Highest.
It's highest, is it? Okay, can you see here now, hopefully, just like to lift his top lid up a little, Jody, get him to look straight ahead. To keep him looking straight ahead. That we've now can see that the touch up here is pretty well gone and the bottom has gone as well. So our indicated lens there would be a 7.2 base curve. If we can just put some fluorescent back in the eye, thank Pooja, just see if we can look at the peripheral fit. I don't know if it's going to be possible, but we'll have a look.
So, Jyoti, if you can even describe what you see on the slit lamp for all of us.
Yeah.
And anywhere that you see.
So if you put some... Okay, so looking at the screen, no, take the light off the screen, thanks. You can't really, unfortunately, the projection system is not good enough for me to show you what's going on. But in the area here, what we're trying to do is evaluate the peripheral fit, but unfortunately, there is no way I can actually show you. All I can show you, the base curve that we required was what Monica projected at 7.2. Okay, so that's all we can do in that case. Can we move to the soft lens now? No. So when you're judging the edge lift, you put fluorescent in, you give a few blinks, and then you immediately try to see, you can see how easy the tears are entering underneath the edge lift? That is an indication you should be able to see the tears entering underneath the edge of the lens, as you can see there. But again, we don't have a good projection system to show it. Okay. We have the lights on, thanks.